Calgary-Currie, followed by the honourable member from Casgrin-Camrose.
Well, thank you very much, Mr. Speaker. I wasn't going to ask about health care, but listening to the questions and the answers that have gone back and forth so far today, I am. And I'm going to ask my questions to the Premier. To the Premier, if primary care networks in this province are working so well, then why are so many sick Albertans falling through the cracks?
The Honourable the Premier.
Mr. Speaker, they are working well, but the demand continues to grow for health care in this province. It's a matter of demographics, a matter of us doing more heart transplants, more heart surgeries, bone joint replacements, many things that we're doing in larger number than we did before. And I do know that primary care health networks are working because in just talking to those that are involved, the patients, especially the people who access services, are very satisfied with the service they're receiving.
The honourable member.
Thank you, Mr. Speaker. Well, again to the Premier, if things are working so well, except for this minor little annoyance that our demographics are changing and the demand is outstripping supply, if he can give us that answer today, Mr. Speaker, why can't he and his government get ahead of this curve?
The Honourable the Premier.
Mr. Speaker, I don't know why we want to point fingers at seniors' population and say what's a minor issue. It's not a minor issue. We're all living longer. We're enjoying a good quality of life in the province. So let's not blame one demographic. We know that we're going to be, of course, living longer, and we have to make those changes. And as I said, 1,300 new beds added just this year alone, with another 1,000 being added next year. That's 2,300 new beds paid for by the taxpayers of the province.
The honourable member.
Thank you, Mr. Speaker. Let's be clear. I wasn't blaming the province's seniors. I was blaming the Premier. How much longer does the Premier expect Albertans of any age and stage in life to wait until things get better on the health care file? How much longer?
The Honourable the Premier.
Mr. Speaker, there are improvements every day. Notwithstanding what you hear from some of the opposition members, but especially with the issues being raised here, get calls of people that have had good access, have been dealt with huge satisfaction levels, especially those that have been surprised with the diagnosis of cancer and have worked through, therapy, radiation, are now here healthy to tell us the good parts of what we have accomplished.
Exactly. The honourable member for Wetaskiwin-Camrose, followed by the honourable member